No question.
Sorry, we had an interesting discussion with Professor Meroni on decisions for DUAC treatment, and he suggested that we should have a closer look at isotypes and titers, which is an excellent idea. Maybe Professor Meroni, you would give us your opinion on the topic.
Can you hear me?
Yes,
okay.
Perfectly.
Without mask, thank you.
Okay. I just raised the issue that probably in identifying the patient at risk, higher or lower risk for the therapy, you should characterize as much as possible the antibody profile. So I mean that although there is a huge variability in the antiphospholipid assay that you suggested in our chat, I think that if you try to select just a medium high titer of antibodies, if you can include just IgG, leaving the IgM a little bit in another situation, I think that you can identify much better the patients at higher risk in comparison to include just the patients defined only as positive or negative, even with double, triple, or single positivity. So I think that this could be useful.
I think it's an excellent suggestion for clinical practice. But for the registry, what we want to know is the safety data for patients who are already treated. So the decision we took for the registry is to include all patients who are not triple positive and who have not arterial history, whatever their profile, to ensure safety of the treatment when they are treated eventfully.
Okay.
Thank you. There's a question on the chat that may be directed to Ricard Cervera. Ricard, I don't know if you're still connected. Thierry Martin asks if anybody has experience with daratumumab in CAPS, in the CAPS situation. So if Ricard is connected, maybe he can answer this question, or Pierluigi, maybe you have an idea also, Ricard?
I'm connected, but I have not. I think there is not any. I think there is not any patients at the CAP registry treated with daratumumab. I don't know if some patient probably in any part of the world has been treated with this biological therapy. Sorry.
Thierry, maybe you can give more information about your question.
I don't know if you hear me.
Yes, perfectly.
So we will have after that some presentation. You can see.
We try to
regarding this.
We try to treat a patient with CAPS, but it was not. Rituximab did not work, and we thought as daratumumab could, but in fact it was not efficient because probably maybe of timely events, because the patient died quite quickly. So, but there is a rationale to do that, maybe more than rituximab. The drug is not currently available easily for such situations. So,
you did not try eculizumab?
No, I don't remember if he was. No, he was not treated by eculizumab, I think. No.
Okay.
I think that Daniel Plegazuelo had experience.
Yes. And we will see later in their presentation.
Exactly. Thank you, Ludmila. We will present, Raquel Diaz-Simon, my colleague, we will present the case of a young woman with APS, but not catastrophic, treated somehow successfully. I'm not going to show all the details, but we're going to see them later. I think this is the first case of an APS patient treated with daratumumab. We will explain all the details later.
Okay.
It's interesting. Thank you very much.
Thank you.
So we need to go
Okay,
to after
let's go.
presentation time.